Bismillahirrahmanirrahim. We will discuss the topic of neurofibromatosis. Neurofibromatosis mainly it is a disorder that primarily affects the cell growth in neural tissues. This is very important point. Cell growth in the neural tissues. और इसकी दो मेन टाइप्स हैं. टू मेन टाइप्स आर न्यूरोफाइब्रोमेटोसिस टाइप 1 एंड न्यूरोफाइब्रोमेटोसिस टाइप 2. Neurofibromatosis type 1 is also known as von Reckling-Hausen disease, and it is most common phacomatosis affecting 1 in 4,000 individuals, having autosomal dominant inheritance with irregular penetrance and variable expressivity. 50% have new mutations. So neurofibrin is present on the chromosome number 17, and its mutation or a lack of this gene, which carries the neurofibromin protein, will cause the excessive growth of cells, leading to tumors and deregulation. Presence of optic nerve glioma and leash nodules, that is iris hematomas. ये diagnostic ophthalmic diagnostic signs. These are the ophthalmic diagnostic signs. Genetic testing has also role, and systemic features as shown in the picture. Systemic features are neurofibromas shown in picture A, excessive cell growth leading to elephantiasis nervosa is present in picture B, elephantiasis nervosa. And the third one is macules. These macules are specially called as the cafeolate spots or cafeolate macules. These are the systemic features. Some other systemic features involve the axillary and inguinal freckles. There will be hyperpigmentation, and there will be skeletal abnormalities like short stature and facial hemiatrophy. Half of the face will be hemiatrophied. Intracranial tumors are very common, like meningiomas and gliomas. Associations involve the malignancies, GITs, stromal tumors, hypertension, learning difficulties. So recent research suggests autism spectrum disorder affects nearly half of the all neurofibromatosis patient. Associations में मेलिग्नेंसी है, GIT के स्ट्रोमल ट्यूमर्स हैं. इसके अलावा हाइपरटेंशन यानी पेशेंट का BP चेक करना ज़रूरी है. लर्निंग डिफ़िकल्टीज़ भी हो सकती हैं. Skeletal abnormalities means facial hemiatrophy. I have seen this patient in the OPD. Half of the face was like deformed and atrophied. Now the ophthalmic features. Ophthalmic features involve the, as shown in this picture, these are very good pictures. These are the eyelid plexiform neurofibroma, or you can say nodular plexiform neurofibroma. S-shaped deformity of the upper eyelid है, and it gives characteristic appearance of bag of worms in texture. And there is optic nerve glioma in 15 to 40% of the cases, and it will lead to slowly increasing painless proptosis, visual impairment, and optic atrophy and strabismus. Some other tumors are also present, like neurolymoma, plexiform neurofibroma, and angioma. However, sphenoorbital encephalocele, which will be shown in the figure F. Orbital features are optic nerve glioma, and in 15 to 40% of the cases. And as one other specific feature is sphenoorbital encephalocele, which will cause the herniation of the intracranial contents and will cause the pulsating proptosis. Then if we see the eyelid, we have called there is specific nodular plexiform neurofibroma. When we see the cornea, there will be prominent corneal nerves. When we will see the iris, there will be iris nodules, which are called leash nodules. um, and there will be mammillations on the iris. There can be ectropion uvi, congenital ectropion uvi. And in case of gonioscopy, we can find unilateral glaucoma, but that is not very common. 50% have ipsilateral neurofibroma of the upper eyelid and facial hemiatrophy and fundus. When we examine the patient after dilatation, we will see that there is a possibility of choroidal nevi that can develop into the choroidal melanoma and some other features of congenital hypertrophy of the RPE, myelinated nerve fibers, hypertrophy of the retinal pigment epithelium, myelinated nerve fibers, combined hematoma of retina and RPEs may also be present. Neurofibromatosis type 2 is carried by the chromosome number 22, which carries the protein merlin, and its mutation will cause the irregular cell growth, and it is autosomal dominant, and 50% are sporadic. There is involvement of bilateral astrocyte acoustic neuromas. There is bilateral acoustic neuromas. This is the main feature, and 90% it is present with the family history of neurofibromatosis type. Characteristic lesions like juvenile cataract. Juvenile cataract is specifically important. It presents in about two-thirds of the patient, and fundus, you will see the epiretinal membrane is frequent, and hematoma of retina and RPE is relatively common. There is ocular motor extraocular movement defects. 10% less common are some tumors. That's it.